Okay, it's 4 o'clock.
It's 4 o'clock.
That's right. Hello, all. How are y'all? All good? Okay. So if you're not speaking, if you would please mute your microphone. And if somebody would watch chat for me, Lucia or somebody, to let me know if there's any questions in chat, because when I'm in this display model where I've got the PowerPoint up, I cannot see my chat.
I'll do that, Angel.
Okay. All right. So I've got a few updates to give before the Health Science Educators meeting. So I wanted to go through those of things that are going on in health science. Most of them you already know about, but I want to make sure that you do. Okay, so what's new in health science? I pulled this information directly from the information that I gave to your administrators. So I wanted to make sure y'all had the same information I was giving them. You know, I've got some other notes further on down, but so updated standards in the health science pathway. Y'all already knew that, but I'm not so sure your administrators did. So what changed in Health Science 1 is if you're in middle school or below 9th grade, you do have to have biology as a prerequisite for Health Science 1. If you are in 9th through 12th grade, you can have it as a pre or a co-requisite. So that has changed. That used to be on the books a long time ago. I think it got changed about 5 years ago, and now it's back for good reasons. So Health Science 3 lost its number, and you may have noticed that. And it lost its number because we wanted to make sure, well, the committee that met wanted to make sure that everyone was aware that it was a flexible course, meaning it didn't have to come after 2. It can come before 2. So you do have to have Health Science 1 before you take Health Science 3, or you can have Sports Med 1, EMS 1, whatever pathway you're in. The first level course has to be taken before you can take Health Science 3. But you can take it out of sequence with Health Science 2. And anyhow, so Health Science 3 is now Human Structure, Function, and Disease. Science 1 and 2 had titles added to their numbers, and you may or may not have noticed that. We kind of been working those in over the last 5 years probably, but they may eventually go to just titled courses instead of labeling them Health Science 1, 2, 3, etc. And you know, if you've been in the air, you know, if you're coming into it new, it's not going to matter that much. If you've been in it forever, we're still all probably going to call it Health Science 1, 2, and 3. But you know, that's just us old people. But anyway, they wanted to make sure, a lot of people don't know what Health Science 1 is, and it's different in different schools. And so we want to make sure that we're not just labeling it Health Science 1, that we're labeling it what it is. So when they transfer out of state or people transfer in state, they have a better matchup of getting into the course that they need. Okay, courses that are coming, we got a public health pathway starting in 2021. Right now we've got 2 courses. We may end up with 3, you know, within another year for 22, but 2 courses starting in 21. One is a fundamentals course and one is an advanced course. We are adding Introduction to Veterinary Science as a 3rd course option for Health Science Completer Pathway, and that will have to be taken through the Ag department. But I did look at the standards. They are good, so we're all good. I know there were a couple schools already offering Introduction to Veterinary Science as an innovative course at their school. But if they want to get some type of completer credit, I've added it to the Health Science pathway through the Ag number. Human Services, Sports Nutrition 1 and Sports Nutrition 2 will be added as a possible pathway, not pathway, but addition to a pathway in Health Science. So you can take Sports Med 1, 2, and Sports Nutrition 1 and be a completer in sports medicine, starting in 21. Now, if you're in another pathway like health science or EMS, sports nutrition 1 will not count as a completer pathway unless you take both courses, sports nutrition 1 and 2. All right, courses phasing out this year are health informatics. That's going away. There were actually 9 students that tested in that last year, but I didn't know anybody was offering it. So anyway, I don't know where those numbers came from.
Angel, someone has a question. Chat, if you could email the PowerPoint.
Yeah, it's going to be posted online, and I'll show you where in a minute.
Okay, thank you.
What else is new in health science? Y'all are probably already know all this, but the credentials that are new in the book this year are listed on this PowerPoint slide. And I don't think there's anything that anybody doesn't really know about here, except for maybe the precision exams. They're not counting as an industry credential, but there's a total of 17 assessments that can be counted as a stackable credential for health science from precision exams, and they're listed in the 2021 student reporting guide. You can find the student reporting guide on the South Carolina Department of Ed website under Career and Technology. It is the middle section on the second row of the colored choices that you have, and it says something about data, but that's where you can find the student reporting guide.
Especially if it was low.
Huh?
Hey, this is Rhonda. Can I make a comment? Because there's
Sure.
some people having trouble that when they're clicking on the link in the email that you sent for the updates, it's not opening. So what you need to do is download that link. It'll open and download. It's going to be like black. So download it and then open it in PowerPoint, and you'll be able to see everything. Because I think that's a problem some people are having.
Okay.
I just tried it.
Okay. All right. So do what Rhonda said. Okay. If you have any issues, let me know. Keep putting them, calling somebody, texting somebody, and let them know. But there will be a copy of this available. This slide shows you where you can find the student reporting procedures guide and the current credentials that have been approved by the Education Oversight Committee. What's new in assessments? The National Health Science Assessment name was changed to the National Health Science Credential. So that's new. And beta testing, as y'all know, y'all been pummeled by my emails at the beginning of school. You're not getting them from me now, but beta testing is available this whole semester. After December, it will not be available for free. So if you want to take advantage of it, you must take advantage of it before you go on Christmas break. Because it won't be available after that unless you contact UScience and set up payment for it. Teachers are able to give the beta test. They are not, that I don't have to have a proctor for that. That's different from the National Health Science Assessment. You contact me about National Health Science Assessment, you contact UScience about beta testing. And so why would you beta test? So beta testing is a good way to inform your instruction, like what you need to know to teach the students what they didn't pick up last semester. And really that's it. I mean, we put the beta testing in place because of what happened in the spring, so teachers can kind of get a clue of, you know, did students learn anything or did they not learn anything? So that's there to benefit you. So use it while it's free.
Angel, questions in the chat about certifications that students receive after graduation. Do those count or no? Because of COVID, we had some certifications that were not tested and received until after graduation. Will those be counting or not?
Well, I'm not sure of the deadline, but I want to say like the end of June is the deadline for schools to put them in. And there are a few certain certifications that counted up until August. And those were only, in my area, it was only nurse aid. As far as, I mean, they count perfectly for the students, but as far as counting them for your school, yeah, they don't count.
Thank you.
Mhm. So skills checkoff, currently for this pandemic year, all skills may be simulated in a school lab, a hospital lab, with virtual teacher instruction where you have return demonstration. There's some CTE guidelines out that are kind of give you an idea of how you can do that and lists a few things in there, tools in there that you can use. Of course, y'all been sharing those around on the Facebook page and on the NCHSE page. So y'all already pretty aware of the demonstration skills that you can use virtually for your students. And this year, students are allowed to do CPR virtually. We're not holding them to having to do the in-person checkoff. I know they can't be BLS certified that way. Unless you need them to be BLS certified for something this year, we're giving them a freebie this year. Once we start back into a regular school year where everything is normal, then we'll go back to what's required. And so just, unique times, go with unique ways, what you have to do to make things happen, right? All right. So what's new in health science? Again, the guidelines were new. Priority standards are new. Priority standards are the minimum number of standards, or the minimum type of standards that you have to teach your students. This was a committee helped design these priority standards. So if you have questions about the priority standards, look at them. Most of them, especially the health science ones, are really condensed. So they make it pretty easy. There's a couple of them, I want to say maybe EMS that didn't condense so much. For good reason, y'all understand that. And so check those out if you hadn't already. Pandemic health science guidelines, they're posted on the Department of Ed website as well as the South Carolina HOSA health science page. So just guidelines to kind of give you what to do about face-to-face instruction, virtual instruction, those types of things. They're in addition to what Accelerate Ed came up with, so keep that in mind. So this isn't new, but we talked about this last time, so I wanted to bring this up. This is new for this year based on the Perkins legislation. They changed the wording from at least 2 units to at least 2 courses. So a concentrator has to have 2 courses to be a concentrator, not 2 units. So just keep that in mind. The CTE completer, this is an update from last time. Last time we talked September, I think beginning of September, they were going to follow the concentrator path and go to courses instead of units. But after discussion in their groups with administrators, they decided to stay with the units. So a CTE completer has to use units or may use units instead of courses. That won't be any change from what you have been doing in the past. So just giving you an example. The only people this really affected was there are some career centers out there who had students that they were given health science 1 instruction 2 for 2 units and health science 2 instruction 2 for 2 units. So they were ending up being a 4-unit completer. And so now they can still do that. So 4-unit completers are the same as the old stuff. Something to note is that for health science clinical study, you have to be a completer to sign up for health science clinical study, or a concentrator who has had A&P before taking health science clinical study. So the A&P won't count as a unit, but the clinical study will count as their 3rd or 4th unit. So the next update as far as what health science is doing, if anything changes for the upcoming 21-22 school year, besides what I told you today, will be March the 23rd. So you can put that on your calendar. So this is what I was going to tell you for past recordings and future links for any upcoming Zooms or Microsoft Teams webinars. This is the link that you can get those recordings. So anything that we've done in the past, if you missed September's, it's on there. The recording is on there. Just go to this link. It's on the South Carolina HOSA website on the Health Science Teacher page. And it's right at the top. It's like the third bullet down. And you'll see something about webinars on there. Just click on it. And you can find all the links to any previous webinars as well as any upcoming webinars. And that's just for health science. South Carolina Department of Ed has their own website where they have links. And you can go there for all the other programs. These are the resources that were used during this portion of the webinar today. So we're fixing to turn it over to the HSE division. Does anybody have any questions before I leave this section? No? Okay. Please feel free to call me or email me. I mean, I think we're all still kind of spinning a little bit. So, you know, if you think of something after this webinar that you said, oh yeah, I meant to ask her that, go ahead and email me or call me and I'll be happy to answer those questions for you. Okay. All right. Turning it over to Ms. Lucia Watson.
Thank you, Angel. Welcome, everybody. I hope that this webinar finds all of you healthy, happy, you and your loved ones getting ready to get fat for Thanksgiving, not sick. And we're going to give you some information about what's going on in our division. And we encourage you to listen, ask questions, and hopefully join us. Okay, I'm going to call this meeting to order, and I would like to again welcome you to the meeting. And any guests that we have, a special welcome for you. I am Lucia Watson. I teach at Conway High School. I am the president currently of the Health Science Educator Division. My esteemed colleagues, Rhonda Evett, who is the immediate past president, Karen Edwards, who is the president-elect, Tina Elmond, who is our secretary, and Debbie Tush, our treasurer, along with our esteemed Angel Clark, all welcome you to our meeting today. We wish we could be in person, but this is how we're rolling now. Okay, we need to review the minutes, and I'm going to turn it over to Tina Elmond, who will do that for us.
I need to quit sharing.
I don't know, maybe she can just speak.
I'm here. Hello, everybody.
They're really short if you want to read them out.
Oh, I was just going to hit the main points, if that's okay.
Yeah. That's fine.
At our last meeting, we reviewed and updated our bylaws, and those should have went out to all of our members, and hopefully everyone voted on those. We also went over our membership and the finances per Debbie Tush. We discussed ways that we can increase our membership. And then we proposed to add a year to our president and our president-elect to their officership due to the pandemic and the limited meetings and conferences and everything that we've been able to accomplish this year. We felt like that would be a good time for continuity of those offices. And that's everything in a nutshell.
You know, we usually have in there to vote for the minutes, but I think that we can just accept the minutes as we have them because we don't really have any detailed minutes for this meeting. So if anybody has anything they want to add, I will send you 2 corrections I found, Tina. They were just spelling. That's it. That's it.
Okay.
Yeah. Anybody want to have? Yeah. Anybody have anything to add from last year's HSE? Okay. Go ahead, Lucia.
Okay, Treasury report. Debbie Tush, if you would provide us with that, thank you.
Good afternoon, everybody. Just like the others have said, I wish we could be in person, but we're not, and so we'll do the best we can. We have a current balance right now of $40,812, and that's much higher than usual, but that's because of conference changes because of the virus. Over the year, currently we spent money on registration for approximately 20 different teachers and scholarships for the NISHE conference that just concluded. We also spent money for the honorariums for teachers who are presenting in national webinars or managing the Google Drive content and access. We've spent money on awards. We're planning to give more away for teacher professional development opportunities. And we'd also like to plan to have more student training opportunities, including anatomy and physiology. We usually have Starla come in, and we're looking at opportunities for her to be able to teach a course virtually to different schools. So we're looking forward to spending some of this money, but we also have to save it because we have other conferences and things coming up.
Thank you, Debbie. Anybody have any questions? Okay. Karen Edwards, President-elect, Google Drive, Membership Drive, and Curriculum Enhancements.
She may not be on here, so you could do that part, Lucia.
Okay, well, the Google Drive is fantastic, and you have to be a member of the Health Science Educator Division to have access to our Google Drive, but it is loaded with plenty of things for you to have your students do, both virtual and in person. And Karen manages that, so contact her if you would like access to that, if you are a member and you don't have access to that. But let's talk a little bit. Yes, ma'am.
Sorry to interrupt. It looks like Karen just came in.
Perfect.
It was perfect timing. I just got done with my faculty meeting. I don't even know what we're talking about.
Yeah, we're on your slide. See, we just introduced you. We're on your slide.
Oh, yay. Okay, so the Google Drive is only for members now, so you have to join the HSE division, and it's $75 for the state. You do not have to join on a national level. When you join, you've got the insurance, access to our health science Google Drive, discounts on various registrations, giveaways. I know that one of the giveaways will be the national enhancements. Angela said that. And then you are also eligible to win awards, which those will be opening up. I'm not sure if that's been mentioned yet or not. You also have opportunities to register for scholarships to different conferences throughout the year. Here's my smile.
Oh, okay.
That was really quick. Yes.
If you that's what we were going to ask, because I had a question in the chat about your contact info.
Yes, that's the email. You can also email the school email address, and I'll put that in the chat so you have it. If it's an emergency and you need it like within the next 12 hours or so, I would email my school one because I check the other one like every so often. But I'll put my school email address in there. Again, that one's for like if you need it super quick, you can't find something in there and need it, fairly soon, less than 24 hours. So yeah.
Okay.
The enhancements, we're a member state, so the cost for the enhancements is $350 for the national enhancements. I can tell you that if you have not purchased that yet or had your school district purchase it for you, it is definitely worth it. Lots of people pull from it daily almost, or at least within the different units of all levels of our health science. You can order it through the website, and there's tomorrow is a webinar about the enhancements. The URL to register for that is located on this slide. Nancy Allen also sent out an email yesterday or today about the webinar. So make sure that you join that if you have not already. And again, the enhancements, it ends up being 2 zip drives that you download to your computer. So each teacher at your school would need to have their access for the enhancements. Voting. Rhonda?
Yes, I will turn that over to Rhonda Abbott, our immediate past president. And I hear her.
Hey, yeah, here I am. So a copy of the I emailed last week to all current members a copy of the updated bylaws, as well as the motion to keep our current president and president-elect in their office for an additional year. Emailed those out to current members last week with a Google form to do the voting and a link to be able to review the bylaws that we made changes to. So currently, out of about 60 members, I have 11 who have voted. And so I did send a reminder email out to paid members today to try to hop in there and vote, because it's very important for us to, have a voice from everybody. If you're not a paid member, that's fine. You didn't get that email, but I did send that out to the list that we have on file. And if you're not a paid member, then we have the link for you to join. It's a great organization. We're proud to be executive council for it. And it's been a huge help to each other throughout all of this. And also on a national level too, our team has really stepped up to be some help to everybody. So if you have any questions, if you're not sure if you're a paid member, or that, because normally we will renew our memberships every year at our annual conference. And since that didn't happen, there are several memberships that are either expiring this month or next month. So if that's something you normally do, you probably want to hit that link that Angel sent out and that I sent out to go ahead and make sure that you're renewing your membership. So that is all I have. And I'll check sorry about my dog in the background. I will check the chat to see if you have any questions for me also.
Yes, there is a question for you in the chat. Thanks, Rhonda.
Okay, great. I see Sarah McCrew. All right. I will, Debbie Tush has the most current members list. So I will get with her and see, and I also have a copy of it, but we have to get those lists from the South Carolina ACTE person that processes the memberships. And sometimes they're not very quick about getting us that information. I know it was 3 to 4 weeks processing before my membership that I sent in for renewal got processed. So her and I can hop on there and look. And if we don't see your name, if you will, okay, I do see your email address. So I will let you know for sure if you're on that list.
She's on there, Rhonda.
Okay, well, then if you're on there, check your spam, because it may not be, if any of you are not getting emails, check your spam, and I will look at the chat and double check your current email address with the one that we have on file. And I think that's all for me. So,
Rhonda, Rhonda, sorry, this is Debbie again. Maynard says that they're on there, and they are truly on the membership list. So you might just, again, they could check their spam, and we might need to just double check their email.
Yeah, that sounds good. I will copy and paste these emails over and check them from the chat room. And so
I can try to forward it from you, Rhonda, as well. If you forward it back to me to the list again, I can forward it to them, because sometimes they'll get my email.
Okay, that sounds great. I'll do that. And if anybody else isn't currently getting emails and you think you should be on that list, please just throw it in the chat, and I'll be keeping an eye out for it.
Also, Rhonda, you had one more about award nominations
Let's see.
that are coming up.
Okay.
Go to the
Yes,
next
can-
screen. Oh, yeah, there you
Okay.
go.
Okay, there we go. All right, so we will, you're gonna have those on the, all right, so the link on, for awards nominations is gonna be, there in the PowerPoint. And there will also be a list of, awards that you can nominate fellow instructors for. It really makes a difference. Oh, and Anderson 5. Okay. It really makes a difference when you're recognized. I mean, we sent out early on some, to try and get people nominated. And every year, even when we are in person, we don't have a lot of response from that. And, it's important if you know of somebody that really deserves to be recognized that you do that. But also for anyone to receive an award, be nominated for an award, they have to be a state member of HSC ACTE. So just make sure that that they are a current member, and then they can definitely be recognized for all the great things that they're doing.
And I'm not going to click on the link, but I did include the link with the list of the awards that you can vote on. So the official voting form will be sent out in the next few weeks, no later than December the 1st, but probably before then. And they're going to be due back on December the 20th for nominations for awards.
Wonderful. That sounds great. Well, thank you so much. And I will try to go to that link. Actually, since you have it right there with you, Angel, if you want to throw that link in the chat, that way they can go ahead and just pull it straight up. And then you have my email address. And if you'll take that email address, and I'll type it in the chat also, if you want to save me as one of your contacts, that also might help if you're going to be receiving membership emails from me and things. That way, you're going to receive it. So anyway, everybody's doing a great job. I hope you're having a great year. And I'll just keep an eye out on the chat for the rest of the meeting to see if I can help y'all.
Rhonda, did you put the code in the chat?
No, because you called my name.
Okay, well,
I'm in the
put that
process
in.
of doing it
I
right
can't
now.
I can't operate the chat when I'm in display mode.
And I'll
So,
handle it. I'll handle
yeah.
it. Yeah,
So,
I'm halfway
anyway.
done.
Okay.
All right. Thank you, guys.
And all right. Some upcoming professional development opportunities that you may want to make a note of is December 2nd through 5th this year. ACTE is having their Career Tech Vision Professional Development Conference, which is virtual. So you will receive some information about that. And then hopefully, next slide, Angel, we will be going back to our own conference in Myrtle Beach a year from now. But before that, we've got the EBS, which has been decided to be virtual as well. That's July 19th through 22nd. That's coming up this July. It should not interfere with HOSA Nationals. If I remember correctly, they made it a little bit later, so it will not interfere with HOSA Nationals. And then hopefully, fingers crossed, everybody, fingers crossed, we can get back to our conference in Myrtle Beach this November, so a year from now. It is a wonderful conference. If you have never been, I just cannot speak enough about how great that conference is, the great information that you're getting, the networking that you're doing with your colleagues from other schools. My big project, I have to still give Teresa Hayden credo for that, because it was just a conversation I was having with her, and I came up with this amazing project based on just a little bit of information from her from a conference about 4 years ago. So, well, no, it's got to be about 6 years ago now. So I strongly, strongly, strongly recommend that you attend that conference if you never have. So put those dates in your calendar. And then Nishi should be back in Charleston in 2022. So hopefully we'll be able to attend that this coming year as well. Well, not this coming year, but in a year and a half, hopefully. Okay. Angel, you want to speak about the
No, the resources.
yeah,
No,
the resources?
I just put them in there in case anybody wants to access them.
Okay. And then we're going to have a short update for HOSA, and that will conclude our meeting.
Okay, and Lisa's not on today, so I'm just going to fly through this. The list of the team is here and on the website if you need it. we're still taking online membership. You can do online membership or you can do it through your school. It doesn't matter which. Just encouraging students to register. We've got a lot more students than we ever thought would sign up this year. I think we've got close to 1,500 already signed up this year, which is great. So we're still encouraging that. Of course, that's about 1,000 less than we normally have, which, I mean, I didn't think we'd get this many, but anyhow, I'm really happy about that. And we've got some exciting opportunities coming up and that just happened. If anybody got to participate in HOSA Week or Fall Leadership, HOSA Week, we had a lot of good speakers. Most of them were pre-recorded and for good reason. I mean, you know, it's a lot easier to do that and get it up in a timely manner. We did have a live DHEC webinar on that Thursday of HOSA Week, and it is recorded and put on the website under HOSA Week. And you can have your students watch it as an assignment and fill out the survey afterwards. The information for HOSA Week will be up until December the 1st, and it'll go back up during our state conference again, because it's such good information that we wanted to use it again, so we didn't want to leave it up all year round. The Fall Leadership took place last Saturday, November the 7th, and it was a really, really good conference. It's a lot of work, but we got it pulled together. We had it recorded at a studio live, and the speaker was there live. The keynote speaker, all the students were there live. It was a really, really great conference. So you can watch the conference. It's very short. It won't take up a lot of time. You can assign parts of it to your students. There's some breakout sessions about leadership and competitive events on there. And the advisor meeting video is also on there if you want to look at that. Upcoming webinars. December the 1st is the HOSA registration information. And we'll go ahead and tell you now, we made a decision that we're going virtual for the State Leadership Conference. So HOSA registration information on December 1st will be all about what's being offered, how you're going to be able to register, what the students are going to be able to do. They're going to be able to do skills this year. There's a lot of things going to be involved with it. I mean, last year was good, but this year is going to be great. So encourage your students to participate. They're still going to get to do their skills, and it's going to be a great conference. So make sure you tune in on December 1st for the HOSA registration information. And those are some other dates that are up there about HOSA question and answer sessions. People always have a lot for a couple times before the state conference happens. We're going to try to keep the state conference the same week that we normally were going to have it, which is March the 10th through the 12th. We may extend the week a little bit, you know, start that Monday instead of just that Wednesday, just to make sure that we have enough time for everybody to test and to get the judges to judge everything. It just depends on how we can get it coordinated. But anyway, so just want to make sure you know all about that. And if you have any questions on HOSA or health science, feel free to reach out to me. And actually NCHSE as well. I am on the NCHSE Executive Committee and have lots of great information about that. And that's about all I have for you. Anybody got any questions?
There was a question in the chat box about how much registration for the virtual SLC will be.
I can't give you a price right now, but it's going to be very low. It's going to be like $25 maybe. Okay. If, you know, I can't see it being more than that. We still have to charge a little bit because we have to order all the awards and medals and things like that. And we are actually still having to pay the hotel, believe it or not. We just had a letter sent to their legal team this week to see what we're getting out of and how much they're going to charge us for what, but we're trying to work something out with them where we do a kind of a hybrid type conference where our student team goes there and videos in real time for the conference. So hopefully they'll make some money off of it and work with us on this to, you know, not charge us so much for that. Anything else?
Hey, Angel, can I say something about FLC?
Sure.
I just wanted to say how awesome it was. The officers, they worked so hard to engage everybody's students during the week, and they just really did awesome. And the whole conference, the Saturday conference, was awesome. We had a lot of students join, and we're chatting with officers in the live chat. And I just want to say that state, now that, you know, SLC turned out really pretty awesome for such short notice, having it virtually. And I just can't wait to see how virtual SLC is going to look this year, knowing that we have this much time to plan, because FLC Fall Leadership was so awesome and had such great student engagement that I know we're going to have the same for state. That's all I wanted to say.
Well, and one thing about the Fall Leadership Conference, one of the best presentations was at the end of the day when when the officers were doing officer training. There were such great interaction and questions asked, but I turned over host duties to somebody who turned over them to somebody else. So somebody didn't hit the record button, so we don't have that on record, and I hate that. Yeah.
Angel, could I ask another question?
Sure.
Could we list the membership list? Could you send that out? Because there are still so many people who get confused between the different kind of memberships and what all the acronyms mean. We technically have 31 members, but there are a lot of people who think they're members and they're not. Is that something you could send out in one of your next group emails?
Sure, I can send it out. I don't have a problem. I can send it out today. I'll send out the last list you sent me. Is it the most updated one?
It is.
Sure, I'll be happy to do that.
Thank you.
Okay.
This is Rhonda. I just posted a link for the live Q&A tomorrow that Katrina and I are doing on the enhancements. And I don't know what the details are, so I may need one of you guys to hop in, but I kind of want to offer a shout out and congrats to our two South Carolina people that were elected to national officers on the HSE side. So it was Amanda and Karen, I believe. So Katrina can say more about that, but that's huge, and big congratulations to all of you.
Yeah, congratulations to everybody. They did a great job. We got lots of South Carolina representation across the nation. Y'all just don't know. We've been all around, from Department of Ed to the teacher level, have been doing a lot of national presenting. We are leading the pack, I can tell you that. So. And Katrina, I wasn't throwing you under the bus about recording. You know that, right?
What? That
Yeah.
was not me. That was not.
Yeah. We just totally forgot. At the end of the day, it was just misfortune on our part. But anyway, I blame myself too. Anyway, all right, guys, if you don't have any more questions, like I said, feel free to call or email me or anybody that's on the committee for questions, and we'll be happy to answer them. But otherwise, have a great day.
Okay,
Great
and
rest
we
of the
need
week.
to adjourn the meeting.
Okay.
Okay, motion to adjourn?
Yep.
All right, we got it.
Thank you, guys.
Bye, everyone.
Thank you.
Bye, y'all.
Don't hesitate to
Bye.
reach out to any of your colleagues if you have
everyone.
any questions.